talking about physical activity in clinic with your pediatric patients with physical disabilities. Physical activity is important for everyone. This includes adults and children, and individuals with and without disabilities. The purpose of this video is to talk about discussing physical activity in clinic with your pediatric patients with disabilities. Preparing. Step 1. Knowing the current recommendations. The first step in preparation is to know the current recommendations for physical activity for your patient population. Children and adolescents should participate in 60 minutes or more of physical activity daily. Preparing. Step 2. Knowing your community resources. The second step in preparation is knowing your local resources. This includes organized physical activity groups in your area, including those specializing in adaptive sports and recreation. In clinic, step 1, taking an exercise history. An exercise history in the pediatric population can be divided into 3 main components. The first part is physical education. The second part is free play, or unstructured physical activity. An example of this would be playing basketball with your friends. The third part is organized sports or recreation participation. Within each component, you should ask about weekly participation hours and should find out more about the specifics of the exercises performed during each of these activities. In clinic, step 2, counseling about physical activity. Not everyone exercises as much as they should. Because of this, sometimes your patients may not have much physical activity to report. In those instances, it is helpful to ask about what physical activities might be of interest to your patients. Sometimes your patients will have answers for that, such as, "I've always enjoyed swimming," or "I like to dance." Hopefully, if you know the resources in your area, you can help connect your patients to help them become more active. If your patient does not have an activity that interests them, you can suggest some based on the resources in your area. For some, this may spark interest, but of course for others it may not. For patients who do not have a big interest in organized physical activity, it is important to talk about the health benefits of physical activity. It is also important to talk about how physical activity can actually be a lot of fun. Sometimes it may be difficult to connect someone with a local group due to geographical location or logistics such as time, transportation, or finances. In those instances, it would be helpful to guide your patients towards exercises that can be done at home. This concludes the video. Thank you so much for watching.